It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the most outstanding physicians in all of the Houston area that are helping to change people's lives.
And when we're talking outstanding physicians, we have to lead with one of the best bariatric surgeons in the entire Houston area. That is Dr. Robert Marvin.
Went to a walk-in clinic one night. They told me I was having a heart attack. Sent me to the emergency room. It wasn't a heart attack, but they did run the test. The cardiologist told me that I had slight blockage. He said, you can save your life by having that surgery that you're scared to do, or you can be dead within a year.
She had high blood pressure, high lipids in the blood. I think she had some asthma, chronic back pain, depression. I mean, these are all comorbidities, we call them, of obesity. And her weight was out of control and going in the wrong direction, and she was heading for a big problem.
So I contacted the office, and my son and I did it together. We actually came to the seminar. He did his first, I did mine second, and it's been a little over 3 years.
A gastric bypass is where we create a small pouch of the stomach at the top, and then we bring some intestine up and hook it onto that pouch, bypassing the majority of the stomach and the very first part of the intestine.
I can eat pretty much anything. I have to watch and maintain for the rest of my life, because this surgery gets you to the low point of your weight. Then it's up to you to maintain it and take care of it for the rest of your life.
Well, she was 330 pounds before she started. I think she's 148 pounds now. That's a significant weight loss, I think, in anybody's book. And that's not atypical for a gastric bypass. That would sort of be what we hope for and expect, and she's well within the bell curve of our outcomes.
My advice would be, it is a life changer, but I did it to save my life. Some people want to do it to be vain. I didn't. I wanted to save my life and live a long time because I had kids.
Nobody wants to have an operation. It's not fun, it hurts, you miss work, but the benefit to be gained is significant. And the change in life is significant, and once the patients start to move in the right direction, their whole attitude usually improves quite a bit, and they're much more happy.
It gave me energy. It has inspired me to be and do more than I thought I could ever do in my life.
Gina was looking for long-term effective birth control, and Dr. Maurice Leibman's E-Sure procedure was the perfect solution. To hear more about Gina's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Colleen had a robotic hysterectomy. She had abnormal bleeding after menopause, and that is always a very worrisome sign if a woman experiences.
My cervix was very thick, and of all my symptoms, and because of my age, I'm 62 years old, so it was time.
Now Colleen was potentially a case of uterine cancer, so I decided to do a robotic hysterectomy on her so that if we needed to, we could continue after the hysterectomy looking for cancer in other places.
I was very impressed with Dr. Imtiaz when I came into her office and her staff. They lined all of my appointments up for me. I just couldn't have been happier with her. I knew as soon as I met her that I was going to be in good hands. She explained everything great.
Robotic hysterectomy I usually do for patients who may have other conditions that preclude them from having a routine laparoscopic hysterectomy. Some of these conditions could be a very large uterus, or if we suspect cancer, or if the patient has had multiple abdominal surgeries and we are suspecting adhesions or scar tissue inside the abdomen, or in patients who are overweight.
When I get up in the morning, I think to myself, I just have so much to look forward to because I don't have that pain, that misery, and I have a lot of ambition right now. I mean, I'm able to do a lot more things, and I'm not constantly thinking about, oh my God, I don't feel good today.
You know, as a gynecologist, as a surgeon, it makes my day when I see a patient get up and walk out shortly after her surgery. I think it's silly to have somebody bedbound for 6 weeks, not be able to walk around, not be able to take care of her household, when the answer is simple. I know that I can get them up and about and moving and back to their life immediately.
All of the physicians featured here on the Best Docs Network are committed to helping change people's lives. Like our next doctor, it's allergist Dr. Lynn Dickens.
Kyle is almost 12 years old, and he actually became a patient here a little over a year ago. But he is a pretty basic, typical boy who developed his allergies about the time he started school.
Well, Kyle plays baseball during spring and fall season. And during spring, his allergies are always acting up. Sneezing, runny nose, coughing, what else? Nosebleeds. So that prompted us to go to an allergy clinic.
He's allergic to the spring trees, the grass in the summer. He's allergic to the weeds in the fall. He's allergic to the mold, but not luckily as much, but animals as well.
Well, at home we give him Singulair every day. Sometimes we give him Zyrtec. But as far as the clinic, they're planning to put him on a testing, like he's gonna get some shots every week, every 2 weeks.
So as soon as school is out, we're going to bring him in here and we're going to do what we call a modified rush procedure, or it's also referred to commonly as cluster immunotherapy. And what we're going to do is we're going to give him multiple doses on one day, building him up quickly through the more dilute vials so that he'll start to see benefit sooner.
It will help him a lot. As far as outdoors, I think we can enjoy outdoors more than we do now, especially spring season.
The advantage of doing it with shots versus under the tongue is that the immunotherapy that we do has been proven to be effective in actually reducing the amount of allergy antibody that circulates in the blood, and also raising the amount of protective antibodies in the blood that prevent you from responding in that fashion. And some true immunological changes occur with the allergy shots. I'm pretty sure he's going to respond. He's a real easy, typical, boy that hasn't quite hit teenage, but is going to start suffering in terms of his sports and his dog and everything else that that he would like to do in his life if he doesn't fix the allergy problem.
Cholesterol is an important thing. You need to know your cholesterol number. Now, there are 3 numbers when it comes to cholesterol. There's total cholesterol. That's important for diagnosing whether you have a problem or not. And then there's HDL cholesterol. That's the good cholesterol. You want that to be high. If you're a man, you want your HDL cholesterol to be above 40, and if you're a woman, you want your HDL cholesterol to be above 50. Now the LDL is the bad cholesterol. That's the most important number to know because that's the one that predicts your risk of heart attacks and strokes. For example, your LDL for most people should be less than 160. Now if you have certain diseases like hypertension or diabetes, or if you're getting older, then you really want it to be 130. That's the LDL, 130. If you have certain diseases like diabetes plus hypertension, then you kind of want to look at a number that's under 100. Now, if you have heart disease or have had a stroke or have significant risk factors in your family, for example, for early heart disease, then you really want your LDL, that's the bad cholesterol, to be less than 70. So know your number. Your doctor can get it for you pretty easily.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Ready Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. But what they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate, it's a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Breast cancer is a field of many specialties. I cannot do everything myself. There's the imaging and the diagnosis of cancer, and then of course the surgical part. And so not one person can take care of breast cancer by themselves.
So here at Memorial Hermann Breast Center at Southwest Campus, we really try to approach all aspects of patient care. We try to get the patient through all different disciplines, and we work as a team to do a whole approach to cancer therapy.
Dr. Rose and I met in 2000. I had been in practice for a year, and he was brought on here to develop a breast center. And up until then, it was just a general radiologist who was reading x-rays. And Dr. Rose was very different because that's all he did, was specialize in breast imaging. And as I was specialized in breast surgery it was an immediate fit.
So it was a very awesome opportunity to collaborate with people who had tremendous experience, large experience in breast surgery and breast cancer, as well as in handling benign breast disease. And it's really very satisfying to work as a team, the surgeons and the radiologists, as well as the oncologists and radiation therapists, working closely together to give the patient the very best care that they can get.
Well, breast cancer has always been an important part of my life. My first experience was back when I was very young, and my mother had breast cancer. She died when I was 13 years old. And so it's always been a part of my life, something that has been important to me. Just like Dr. Rose specializes in mammography and breast imaging, I specialize in surgery for the breast. I'm focused 100% on taking care of breast cancer patients. And that dedication and that focus really drives the quality of the surgery, and it drives the quality of the outcomes as well.
As always, for more information on any of the doctors you've seen on today's show, be sure to visit our website, bestdocsnetwork.com.
All right, Candace, now it is time for one of our favorite doctors. It is Dr. Annie Varughese.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and he had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them. Not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are two sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now, there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are 3 major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks. That's serious. But the most common one that we really address all the time is estrogen. And there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver and, simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now, the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating. It's controllable. Maybe the control is the goal, but we're not going to have terminal hot flashes.
Don't forget, for more information on any of the outstanding doctors you've seen on today's show, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Now to one of the best podiatrists here in the Houston area. It is Dr. Gabriel Maislos.
A bunion deformity is a deviation of the first metatarsal and the second metatarsal. So basically, you know, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation. So I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an osteobunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed, and because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, you know, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then, obviously, for the females, it's wearing the high heels. You know, it's there's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times, I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, you know, that's the rewarding part to me.
I'm an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test, and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
Dorothy, she had multiple teeth that were decayed, and she had failing restoration. So she had a history of having multiple dental procedures on her natural teeth, and these restorations had subsequently failed over time, secondary to wear as well as decay.
I came to see Dr. Metz, and I was, of course, just knocked out. My heart went, he was so nice. and encouraging. He said, yes, I think we can help you.
At 90 years old, she had all her lower teeth removed and placement of 4 dental implants and also placement of an immediate prototype, so to speak. So she had fixed teeth on the day that her teeth were removed.
Right, I had no problem whatsoever. It worked. I could eat and chew, and I looked normal, and I was just perfectly happy with it.
Her situation is not unique. There's many people in her age group that just by virtue of their age, their teeth are beginning to fail. Many of them are under the misconception that they're too old to have oral surgery safely. Although by virtue of their age, that age bracket, we do more implants in that age bracket than any other age bracket. So they do tremendously well with it, just like somebody much younger. And also their health improves afterwards.
And I just was thrilled. That first steak was like out of heaven. It was paradise. You know, it was just wonderful. I was so thrilled and happy.
You know, with their fixed teeth, they're able to chew what they want and not foods that are high in sugar. And so they're healthier in the long run. For one, they're not fighting infected teeth. They have a healthier state in their mouth and they're able to chew what they want. And they're able to have a much more balanced diet.
I would say, don't do that. Don't tough it out. Go get something done. Go get some dental implants and be comfortable like I am.
When you ask these individuals after they've had this procedure done, they say they feel more energetic. They just feel better. And then we feel that it's their body not fighting a chronic infection, that they're in a healthier state overall.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I started having heavier periods where I would have to, make sure that I was near a restroom and, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, wear anything that would, have the ability to, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female, and sooner or later it will stop. But in fact, it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks. So I couldn't even anticipate if we were going on a trip or,
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for, 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then I've been perfect and feel wonderful.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in all of the Houston area that are helping to change people's lives.
And for more information on any of the outstanding doctors you've seen on today's show, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.